Nowadays, long-view radiography is used for most spinal diseases that cause spinal deformity, as well as for post-operative assessment and pre-operative planning for joint replacement in the lower extremities. To capture long-view images, such as the whole spine or whole legs, it is necessary for the X-ray machine to take multiple images that later get stitched together. This requires longer acquisition time and can cause patient motion artifact. Also, image distortion is not desirable because it affects precise measurement in surgery planning. In order to meet clinical requirements, Shimadzu has developed the Smart Stitch family, a line of products that originated from Shimadzu's breakthrough technologies. These 4 methods, Speed Stitch, One Stitch, MX Stitch, and Slot Advance, use automatic stitching and optimized scanning technologies to produce speedier and more accurate scans. Speed Stitch. When examining large areas, such as whole spines to check spine alignment, the classical long view using CR takes approximately 15 minutes from setting to completion of the image, while Speed Stitch produces even better workflow in just a few minutes. This system scans 2 or 3 separate images by automatically moving the panel's position, along with tilting the tube between each scan. These images are then automatically stitched together to produce a composite long view image. In order to scan 3 images, the acquisition time can be reduced to 9 seconds, and the preview image will be shown within a few seconds. The whole process will be done in just a few minutes. Speed Stitch can be performed both vertically while the patient is standing and horizontally while the patient is laying down on the table. Table Speed Stitch is good for elderly patients or stretcher patients who can't stand by themselves. One Stitch. In situations where patients may have conditions preventing them from staying still for an extended period, such as cerebral palsy, One Stitch can be used to optimize the scan time. With One Stitch, 2 or 3 panels are placed together in a slot, and a technologist just needs to take a single exposure. This is the best method that can reduce the acquisition time dramatically compared to Speed Stitch. And the images are stitched together after the scan is completed to produce a composite long view image in just a few minutes. MX Stitch. MX Stitch can be performed in virtually any space, as it is operated using a mobile X-ray machine. In order to perform the MX Stitch, 2 images are scanned of the necessary area, and the panel is readjusted by the technologist between each scan. During the scan, in order to minimize exposure to radiation, a lead mask is placed inside the collimator slot so that the scan is only performed on the body parts in front of the panel. This prevents the same body parts from being exposed multiple times during a large area scan. Similar to the previous methods, the images are stitched together after the scan is completed to produce a composite long view image in just a few minutes. Additionally, the MX Stitch is an intraoperative stitching image solution, meaning scans can be performed during surgery. This allows for surgeons to observe results before closing the incision point and provides an effortless stitching workflow. Slot Advance. Slot Advance collimates the X-ray beam so that it only exposes a narrow central slit field without distortion caused by oblique rays. Both the tube and panels move simultaneously to create a seamless composite long view image in one streamlined action. This method produces superior image accuracy for precise measurement, necessary for surgery planning, faster image reconstruction, and ease for the patient as well. The Shimadzu Smart Stitch family produces more accurate scans and a speedier workflow, while at the same time providing a safer and more comfortable process for the patients. Only with Shimadzu.
Excellence in science. Shimadzu.